Hi everyone, I'm Astrid. I'm a physical therapist with CAT Physical Therapy, and today I'm here to talk about low back pain, which is a common condition that can make everyday activities painful and difficult. Now, during your recovery from low back pain, you want to stay as active as possible and just keep your normal routine, and this will help your back to heal. Causes of low back pain, there are many causes. Many of them are called non-specific because there's no specific disease or illness or abnormality that causes the back pain. And common causes of back pain can include trauma, lack of exercise or physical activity, poor health, and poor repetitive movements such as frequent bending or lifting. However, there's no specific thing that causes low back pain. Now, factors that increase your risk of developing low back pain can be smoking, obesity, physically strenuous or sedentary work, stressful or dissatisfying jobs, or psychological factors such as anxiety or depression. Now, we'll talk about the spine a little bit because it's important. Your spine is made up of bones or vertebrae, and you have those muscles that are on the sides of your spine that act as stabilizers to stabilize the spine. Now, when your back is weak and those muscles are no longer effective at stabilizing the mast of the ship, you will find that your spine becomes very unstable, and you put a lot more stress and pressure on it, which will increase your risk of having back pain. So, in order to reduce your back pain, there are things you can do, lifestyle changes or management, such as exercise. It's important to stay active and continue your activities. Other exercises that might help you would be aerobic activities, yoga, swimming, walking. So that will help maintain your back so that you decrease your risk of having back pain. Other things you can do for back pain is icing. You want to place an ice pack for 10 to 15 minutes every 2 to 3 hours, and make sure you put it in a pillowcase because you don't want to put an ice pack directly on your skin. The last thing is posture, which is very important. You want to practice good posture and habits, good postural habits in the office, during your everyday activities, or when resting, because that will help to reduce the strain on your muscles, your ligaments, and your tendons. Now, you want to seek medical attention if, for example, your back pain is a result of an accident or fall, or if you are 70 years old and or older and you have a new onset low back pain. If your pain doesn't go away, even at night or when you're lying down, if you have weakness in one or both legs, and you also have problems with your bladder, your bowel, or sexual function, if your back pain is accompanied by unexplained fever or weight loss when you're not trying to lose weight, or if you have a history of cancer, a weakened immune system, or osteoporosis, and lastly, if your back pain doesn't improve within 4 weeks. So there you go, a little thing on back pain, and every week we'll have updates on different conditions that cause back pain. So see you next week.